regarding intergenerational inequalities and differences over time. In fact, Eurofound had been looking at challenges of the day over the last decade as they were changing. If we look back into financial crisis a decade ago, we had a series of work focusing on needs, young people not in employment, education or training. After the COVID, we looked into specific challenges and situations for young people and older people in terms of the COVID impact. We have forthcoming report looking into what it means to become adult in the current world. But the most recent exercise we carried out was examining intergenerational differences over time in the EU as a whole, looking into specific areas of life, such as income, employment and work, housing and health. At the end, it seems older workers were slightly better protected, and it hasn't been the case for young workers in all countries, in all situations. Nevertheless, the economy rose fast and steady in the post-pandemic situation, and the employment kept rising, and Europe faced labor shortages. So if you look at employment rates, both in general and for young people, they are on a good trend. Areas of concern that we know from the past, such as challenges of being not in employment, education or training, well, that's also relatively good. The rate of needs in Europe is as low as it has never been. On some dimensions, developments are not that concerning as it may be expected. On other ones, it's not that clear and steady. And if you look at income-wise, situation of young people hasn't been as good as that of older people. Income of young people did not rise to the same speed and extent as it did for older people, whose incomes seem to be protected a bit better. Those differences are not as stark and even in all countries. The biggest challenge uncovered by research seems to be in southern European countries. Over the last decade or so, there has been a feeling that it becomes more difficult for young people to leave parental house and to start living independently. And in this regard, it was thought that a larger proportion of people are staying with parents, or the age at which people leave parental house is increasing. If we look at longer-term trends in statistics in Europe as a whole, we see that not being the case, actually. The proportion of people living with parents is quite stable, and the average age of leaving parental house is also quite stable over time. However, what changes is a tenure type that people starting living independently obtain. The house ownership rates are decreasing, and proportion of people renting their accommodation is on the rise across all age groups. Well, what that means for policy? That means that policy needs to organize regulatory base and also services around new types of housing arrangements that are emerging. We need to look into mechanisms that optimize the cost aspect of housing, but also regulations that define accommodation quality. Well, obviously, recently we had a huge health challenge in Europe during the COVID pandemic, and that attracted a lot of attention to health situation of citizens in Europe. There were many concerns for health of people as well as condition of healthcare system. And regarding health, there are a couple of interesting trends to bring out. First, despite challenges, we see that self-reported health of Europeans had been slowly but steadily increasing. That means more people in Europe over time feel and say that their health is good. However, at the same time, we have another trend. There's also an increasing proportion, slowly, but again, unfortunately, steadily, increasing proportion of people reporting that they have long-standing illness or chronic disease. And with regard to this latter point, long-standing illness or chronic disease, this is a trend among young people as well. What Eurofound had uncovered in examining impact of COVID on different age groups was that for many people, and especially young people, mental health was in crisis. And many people reported that they had unmet need for support in terms of mental health, unmet need for mental health care. A mental health challenge for young people in Europe is a remaining concern. And Eurofound will continue research into this area. There have been and there are very important questions for research not answered in this regard. We don't know for certain yet. We don't have enough consistent evidence to tell whether this deterioration we see in the indicators around mental health among young people is because the mental health is really deteriorating, or is also affected by increasing awareness. Younger generation is more conscious and more aware about challenges, is more conscious about importance of looking after oneself and mental health, and that may be also one of the factors affecting what we see in the data. So we have a dedicated report on mental health services in Europe in the future, and we touch at Eurofound on some aspects of this in discussing what it means becoming adult in contemporary world. If we think about broader implications of findings around intergenerational inequalities, we need to be clear in what context we examine them. And the context for Europe is of the big challenges these days. EU just went through COVID, a big health crisis. Then citizens faced rising cost of living. And then we note the changing geopolitical environment and a continuing war that Russia waged on Ukraine. All that makes certain challenges deeper, more important, and we need to be well familiar with them. And at the same time, EU and European societies have to be able to identify sources of resilience they have. And among them, we touched upon briefly a good situation in labor markets, even though some concerns about potential recession are there. Europe is facing labor shortages. There are jobs to be filled in. The labor force is growing. We also discovered that regardless of the health crisis we had, the long trend is of improving health. More Europeans are feeling good about their health. At the same time, we know that young people especially face mental health challenges. And in that, we need to identify the challenges and support mechanisms that can help them, and also appreciate that young people and society as a whole is becoming more aware about the importance of looking after each other.